All of you comfortable?
I'm extremely
Yes,
comfortable.
Winnie, I'm comfortable.
Okay,
I'm
great.
comfortable as
Okay, great.
well.
Okay, thank you so much once again for joining us. We'll be starting in a minute. I can see people are already in the waiting room. So
Hello, Agnes. Hello, Agnes.
We are just muted, but clearly seeing you, sir.
hi, how are you? Yes, and I will be switching off your video as well. That's okay. Okay.
Oh, hi, okay. I'm also online.
Hi everyone, you're all welcome to today's webinar. We'll be starting shortly. However, I've tried to mute everyone. I would just ask that please do not unmute yourself until you have been picked on to speak, because the background noise really affects the whole experience. But thank you for joining us. We'll be starting in about
Hello.
Sorry about that. Good afternoon once again. Thank you so much again for joining us for this week's webinar series. Last week we had the great opportunity to have a similar webinar, which was looking at MHM and how we can be more relevant, especially now in COVID-19, and how is it that we can collectively plan as civil society organizations to implement programs that ensure that no girl is left behind and every girl has the opportunity to experience her menstruation with dignity. This week, we're going to have in-depth discussions on making a case for sexual and reproductive health and rights come to life amidst the COVID-19 pandemic. We can attest to the fact that the response to COVID has been seen to increase inequalities for women and girls and other marginalized groups. Because there are growing numbers of reports of increases in gender-based violence and sexual exploitation and abuse, even as related services for prevention and response are under pressure. In most instances, it has also stifled women and girls' opportunities to exercise their SRHR due to having SRHR services being sidelined in preference for health security and sustenance. All women and girls must have access to a continuum of sexual and reproductive health services, including antenatal, perinatal, and postnatal care, and screening tests according to national guidelines and standards. So with that, we hope, Uganda Youth and Adolescents Health Forum, in partnership with She Decides Uganda, Right Here, Right Now, and Ministry of Health, have organized this webinar on making a case for sexual and reproductive health and rights come to life amidst the COVID-19 pandemic. The webinar's the objectives of this webinar are to catalyze action and progress for SRHR and bring back to life the need to make essential SRHR services available and accessible for all pandemic. The other objective is to foster a virtual space for sexual reproductive health actors and advocates in Uganda to exchange, share information, and update ourselves on what needs to be done to keep SRHR as a reality despite the COVID-19 crisis. The webinar will also give a background and context on Uganda's sexual reproductive health journey, highlighting key commitments, targets, indicators, and where we are as the country continues to seek to meet its set SDG targets, Sustainable Development Goals targets. We'll have a brief presentation. It will be more verbal on fundamental SRHR issues of women, including contraception, sexuality education, maternity care, abortion care, HIV and STIs, among others. The webinar will last 1.5 hours. 1 hour will be dedicated to hearing from our great panel of experts who I will be introducing shortly. And then 30 minutes will be dedicated to answering questions concerning what has been brought up. I would like to ask that we take advantage of the chat section to pose whatever questions that might come up during our discussion. Please feel free to take advantage of the chat. One of the members of UWAF will be curating the discussion there. And at the end, after all panelists have had an opportunity to speak, we will then have the chance to address some of these questions. Yes, so I just wanted to also go through some additional house rules. Please, 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 for the benefit of all our ears, ensure that you keep your microphone off. I can control it from this side, but not if you have the autonomy to unmute yourself and speak recklessly. So I would like to ask that you please keep your microphone on mute until you are picked on to speak. And then for the panelists, if you have a point to make in the middle of someone else's discussion, please feel free to raise your hand and we'll be able to pick on you, because at least for the first hour, we want to have as much engaging discussion between the panelists as possible. We are unable to have videos of the panelists being shared as they speak, but we are working to ensure that they have at least a photo, so you know who is speaking as they speak. Yes, so that's about it with the house rules. So at this juncture, once again, I'd just like to welcome you to this week's webinar. Like I mentioned, we have a wonderful panel of experts who I will be introducing shortly. We have Dr. Olive Sentumbwe, who is the Family Health and Population Advisor at World Health Organization Uganda, and she'll be speaking to us soon. We also have Faith Shateka, who is the Head of Communications and Policy from Maristops Uganda. We have Miss Anne Sizomu, who is the Technical Advisor Advocacy for Right Here, Right Now, IPPF Africa Regional Office. We have Nachivuka Nur Musisi, who is the Director for Programs at Center for Health, Human Rights and Development, CEHAD. And then representing Dr. Jotha Musinguzi, we have Dr. Betty Chadondo from National Population Council, and she is the Director of Family Health for NPC. Yes, so those are the panelists that we have today, and once again they will be speaking to us shortly. Perhaps I should just let us dive right into it. I would like to invite Dr. Olive Sentumbwe from the World Health Organization to share with us a brief synopsis on Uganda's sexual reproductive health and maternal health landscape, taking keynote of the COVID-19 situation. Are there any key milestones? Are there any challenges, any targets and commitments? And also just looking at the journey so far. Yes, so Dr. Olive, if you would just jump in to give us a background of that, just to inform the discussion that we will be having today.
colleagues, and thank you for being able to make it this evening. I'll be very fast. First, to maybe really underscore the fact that maternal health, newborn health is the most challenging piece now, which we have, which is obvious to everybody. As you know, previously, we've been losing between 16 to 18 women per day. Apparently, even though data is coming in slowly from the districts, we've dropped down to about 55%. We do know that maternal deaths and perinatal deaths are rather high in the first 12 weeks that have been recorded. And that is worrying everybody. All the Ministry of Health departments and the partners are very worried about what this means for the country. Majorly relating to maternal health is the fact that in the beginning, there was a complete shutdown for women moving from the different parts of the country coming to our health services. However, with the recent announcement of the president allowing women to go in anytime, even without authorization and approval from the RDCs, we may begin to see those numbers coming down. But the first 2 weeks were really bad, and the records are correct from most of the parts of the country. So what is happening now is that I should think what we should be doing as all partners, we are trying to analyze further the data to see what age proportions we have amongst the maternal deaths. Who is really finding it difficult to reach us? Where are they and what age they are? This is one of the undertakings of the Ministry of Health and Partners now for further analysis. But we are urging all partners, all ages, to really increase on the advocacy so that our leaders, wherever they are in all the different parts of the country, can allow women to use any form of transport when they need to reach us in the health facilities. And if everybody can join that advocacy network in whatever form, so that our leaders can open up, the different leaders, you know, we have leaders of different types like police, like RDCs, LCs, and all the goodwill people who would like to transport pregnant women. I think that's the major concern we really have now. And to make sure that people understand what pregnancy and delivery is really about, that it has no warning. We hear a lot of suggestions, people in third trimester should report what not. But remember that the woman is the one who is responsible for the entire home. Even as she starts labor, she has to make sure that the children and the husband are fed. So our circumstances are different, but people don't understand it very well. And I urge you all to now begin to focus in that area, because that one is leading to a direct death. Closely related to this, and we are worried about the young people specifically, is that there is a lot going in the houses because people are seated at home, they are redundant. Everybody has predicted that 9 months down the line, we are going to have a lot of pregnancies, a lot of abortions in the coming few months. So we are worried again. We need to encourage different types of people, first of all, not to engage in what they shouldn't be doing now. But even when they engage, they should be using contraceptives at all ages. And we are hopeful that the pharmacists, the health facilities, the private institutions are stepping up provision of family planning services, contraceptives of all types. That has been agreed upon. The Ministry of Health held a meeting early last week, this week, and we've given out new guidance to the health facilities. Social distancing is important. Water, washing hands, all those are very, very important, but the services must be available. Of course, as you know, the biggest fear of health workers is the availability of the necessary PPEs for them to be protected. And the government is trying its best to get PPEs from all corners. But mind you, there are not many coming in from different countries. And now we are seeing really a very limited amount coming in, and that's a challenge. So again, the advocacy is to call upon all partners who can bring in PPEs, which pass the standards, to ensure that they are available so that our health workers are not scared, they're not frightened, they're not fearful, because that's what they are saying. Another area that I'm sure you have all heard about now is the fact that we need to do a lot of sexual and reproductive health orientation of the young people so that they can protect themselves, because they need to protect themselves from STIs, from HIV, from pregnancy. And worse still, we are hearing a lot of sexual violence and gender-based violence, domestic violence, violence against children. It's really on the rise. We don't have the data. People are not reporting easily, but we have seen the stories being captured by the different forms of media. And the police is also reporting it is increasingly seeing this. So we are asking the leaders again to take this as a serious condition so that it is also reported, and we're encouraging people to come to the health facilities so that they can get the necessary treatment. What I would ask this forum is to get all these different pamphlets that the Ministry of Health has, reproduce them in the different languages so that the young people, the older people know what to do when they've been sexually assaulted and why they must report to the health facilities. We are sure that if people have more information coming out to them every day, maybe they'll protect themselves better. So we all need to get together and make sure that this information is widely available to people, and that we are encouraging health workers, we are supporting them to be able to provide services. These are the major challenges which are facing sexual and reproductive health right now, and all the different ages are affected. Of course, the young boys, the young men, the older men, those ones have a special role to play. That now they need to protect themselves, and also they need to protect the ones they love. They need to protect their mothers, sisters from being violated. And they should lead the process of ensuring that their sisters, their relatives are reaching the health facilities. Because after all, they really man the referral systems. And we should expect a lot of support from the men themselves. Right now, the young people, you are being called on to make sure that you are the first responders in service delivery, because you are capable of giving the information. The young people will listen to you, but there are also some of the NGOs which you support now, which are able to take services to the people, to provide real services, so that we protect everybody wherever we are. I suppose that's the picture as it is, but I'm also happy to report that most of the sexual and reproductive health partners, UNFPA, UNICEF, USAID, WHO, Ministry of Health, are really making sure that the guidelines, the new guidelines under COVID for maternal health, for sexual and reproductive health, for violence, are being replicated. We still have a challenge for languages, but they are really trying. But getting out there, we need a lot of concerted effort by all the networks. Over. End of submission. Thank you.
Thank you.
Thank you so much for that, Dr. Olive. Yes, and I'm glad that I was actually going to asking about specific guidelines on SRHR for young people and if they're being disseminated, but I think you have spoken to that in your last sentence. Perhaps also just to throw more light on how exactly World Health Organization in Uganda is working with the Ministry of Health to ensure that young people have access to sexual reproductive health services. Is there anything that you would like to add to that conversation?
Thank you very much. That is the quieter conversation, but we know that the biggest proportion that is being affected by unprotected sex is definitely the young people. Because everybody has said these young people are now available in their homes, in the villages, they are moving around. but the services which need to protect them are not reaching them. First, because everybody is up in arms preparing for those who are delivering, whatever age. So who is giving the young people the pills, the condoms, the emergency contraception? You see, that is why the ministry is calling on the young people's organizations, youth serving organizations, now to do that delivery, that provision, and the sensitization, and the distribution of the information pamphlets, so that they are also supporting service delivery. As the health workers stay waiting for the emergencies, we, the young people, are going out there to find the young people we need to find out in the communities. And the Ministry of Health is talking about outreaches, community outreaches, which are protected, which are working within our guidelines for mass and community outreaches. There are definite guidelines WHO has provided to the Ministry of Health, which have been put in relation to the COVID pandemic in all the areas of work. And our work for sexual and reproductive health belongs to ensuring that we are sustaining the usual essential services. And adolescent health is part and parcel. Remembering that we had just finished the TOT for 40 districts just before the week of COVID started. So we know that districts out there, many of them now could have had providers, but those providers could be having a challenge with family planning logistics and information in the languages they need to have them. And because some of us attend those meetings almost on a daily basis, we know what the ministry is asking to be supported. They're asking for private institutions, for NGOs, for professional institutions to come in and support service provision for young people. And we as WHO have provided the COVID guidelines for MNH. Those have already been adapted. We've provided the provision of family planning under COVID, and they have also been adapted. They should include now all the ages, but a special call for adolescents and people who are suffering SGBV, GBV. The United Nations partners have definitely passed out definite guidelines, and they're available with the Ministry of Health. Over. End of
Thank you once
submission.
again, Doctor, for that. Yes, and you did bring out some key points, and it's good to know that there's something being done and that there are guidelines that have been passed down to health centers to ensure that, just as you mentioned, the key populations who are adolescents and young people are actually getting these services. But Doctor spoke on something that I would like to then reel Noor into the conversation on this. She pointed out the fact that who is distributing, who is ensuring that young people are actually accessing the services that they need to access. So Noor, I'd just like to bring you into the discussion and just ask that, taking key note of the fact that access to family planning or sexual reproductive health services is actually our right, a health right for every young person and adolescent. So considering all the disruption that COVID-19 has brought to the healthcare system, where does it leave the right to health, especially for sexual reproductive health and rights and maternity care? And how is it that us as CSOs can work together to constantly remind government on its commitment to the right to health? Noor.
Thank you so much, and thank you everybody for creating time for this webinar. Allow me remind us ourselves that the time COVID came into this world, perhaps all countries were not prepared. Uganda is not a unique country. I'm very certain we were not prepared as a country, but we moved very fast to give directives. It was a very great move because I think it's really getting results already. But the question is, did we plan for most of the issues? Of course not. That's why we have seen so many voices of women, children, other diseases like cancer, and all that people saying, what are we doing to save lives? The question then comes, what about the youngest population, the young people? We very well know that Uganda's population, a bigger percentage of it are young people. Questions to us are, do they access family planning services at this moment? If so, from who, from where, and how are they actually in position to move? Not to mention the fact that actually some of these people, including the young women, have been receiving these services in silence, like their partners are actually not aware of the fact that they're using family planning. So, of course, this affects the right to health very, very greatly, but also appreciate the efforts of the ministry and the president towards ensuring that the right to health is not violated. We are very aware that oftentimes we look at the right to health as one that has to be progressively realized, but also aware that this is a discussion that all countries have. In light of where this leaves the right to health, especially for young people, practical examples are seen. We have our young people in the houses. For example, some are with their uncles in homes, others are with their aunties in homes. And we also have statistics that actually most of the unintended pregnancies and unwanted pregnancies that we see among young people are coming out of these relatives that we actually have. So of course, there's going to be a lot of violations. We have already seen so many of these, so many cases of gender-based violence, so many cases of inaccess to services. So what we actually seem to see and what we could be doing as civil society, allow me to state that for the very first moment, civil society groups working on maternal health came together. And what they did was to write an open letter to the Prime Minister, specifically indicating the implications of banning women from accessing services. This, to me, is the same journey that young people need and the partners working on young people rights need to move. I think the leaders that we have are doing their best to try and make sure that COVID is suppressed, but we are not looking at the likely implications of what that is. There are things that we must remind our government. Of course, it's in here and bothered as a government and thinking about what the implications are going to be if COVID is left in this country, but not thinking about the burden the health system is going to have if young people do not access services. So one of the things we have to do is continuously remind the government of their roles when it comes to ensuring that the right to health is not violated. So if we could write to them, write to the minister, write to the PS, write to the Prime Minister, write to the president and remind them. Of course, to us, it was a win that the president came up and actually said expectant mothers should move. But at the moment, we are very aware that family planning is not one of the essential services that we are prioritizing as a country. So reminding our line ministers, reminding our COVID-19 team that actually family planning is as essential and of a higher priority at the moment now is one thing that we need to do every day. Let's involve the media as much as possible. Let us work with partners that actually reach out to the people that we want to target as much as possible. I would also want to make mention of the fact that there's already statistics that is moving around that has been done. The Guttmacher Institute has already indicated that we will have a higher burden of about 10% decline in short-term and long-term reversible contraceptives use. That if we have this burden, it would result in an additional 49 million women with an unmet need for modern contraceptives in low and middle income countries. So Uganda being a low income country, one of the things we need to think about is the population that we have. So to me, practical solutions need to be provided. One of these would be that actually to where the people are, the young people are, in the communities where they are, I'm sure it will be very difficult for them to go to the resident district commissioners as directed by the president. But the village health team, where they actually are, it becomes very easy for them to actually access condoms from them. That's one. But also two, it would be very important that one of the things that we are communicating as the task force of COVID-19 team within the ministry is family planning. When you look at the messages that are coming out, family planning is not one of them. And to me, family planning for young people is one thing that we should be singing on a daily basis. So we need to actually have this included into their messages. Also, we need to think about the service providers that are providing these services. They need to be protected, but also their movement needs to be specifically and immediately communicated, such that there's free movement of both the service providers, but also the young people, the women that need to access these services. Of course, it will be very difficult. It is very easy for an expectant mother to sit and and everybody sees she's pregnant. But it's very difficult for a young person, a woman, to move and say, to know that she actually needs an FP service. So kind of being humane in this period becomes more sense, because at the end of the day, the burden is going to be placed on the health sector. Then I think we need to incorporate, think about women seeking services to have a waiver. I think I've already made mention of that, but think about our local council leaders. What is their role in this sense and in this lockdown period? If the village health teams are further from the young people, then the local leaders can actually do something. So to me, it's a matter of kind of connecting a service provider to a local council leader, train the local council leader on how to use a condom, for example, such that that information is passed on to the young people. But also the time is now. Everybody is watching TV, for example, although not all, to actually see what is happening. The way we are placing messages of COVID should be the same way we should be placing messages of family planning and how we need to actually use some of these methods, such that access for young people and also the time they spend with the health worker closer to explain to them is kind of limited. I want to end by saying that if Uganda cannot act now, we are going to get into the world news on having the highest rates of teenage pregnancies, unsafe abortions, and unwanted pregnancies. Because if we don't do it now, we are doing so well on COVID, and I think we are making it world over. But we are going to do so well with the health system.
I'm sorry about that. Let me just try and find the person. Yes, Noor, I'm sorry about that. I'll try and trace the sound. Okay, I think that's coming from Noor. Okay, the assumption is that Noor might have some technical difficulties, but I think she hit a lot on so many key points that are worth discussing. One thing that stood out is the fact that she pointed out the fact that family planning has still not come out as an essential service. We still do not see our government prioritizing access to family planning, especially for young people. And just as she pointed out, if we do not rightfully prioritize access to family planning, then we will see numbers go up as regards unwanted pregnancy and even high rates of maternal mortality, as well as unsafe abortions. So I would like to call Dr. Betty then to the discussion. And the question is, how is it, basing on what Noor and Dr. Olive pointed out, how is it that we can keep sexual reproductive health as a top priority policy issue? And how can we rally the support that everyone has been speaking on of Parliament? How do we rally support of Parliament, CSOs, and keyline ministries in order to ensure that family planning is on top of the agenda? Dr. Betty.
Thank you, Winnie, and good afternoon, colleagues. And thank you so much for organizing this webinar. I don't think I have so much to speak about. Olive and Noor have said so much about what we need to do. although they haven't pointed out specifically that Parliament should be involved, I think we have all been emphasizing the point of advocacy and advocacy and advocacy. And I think one of the major groups that we need to advocate to is the members of Parliament. And it is good that Parliament continues to sit on a regular basis. I think on top of, there are so many letters that have been written to the Minister of Health, to the chair of the National Task Force of the COVID-19. We need to write and draft very quickly a letter to the Speaker of Parliament indicating that sexual reproductive health
Hello, sorry, doctor. Okay, I think we seem to have lost doctor. Okay, once she gets back on the call, we'll get her back on speaking on how we can engage the Parliament. And of course, already she's made one recommendation, and hopefully we'll be able to build onto that. Now I'd like to address my next question to Faith from Maristops. We have the different panelists have already pointed out the challenges being faced as regards unmet need for contraceptives, lack of access to these contraceptives, even if young people already have shown willingness to not want or not even be ready to have babies at this time. So what is the implication of the fact that during COVID, the lockdown measures taken to respond to COVID-19 are bringing disruptions that we have already spoken of? So what are the implications of this, and what is it that Maristops is doing to try and support the government or advise the government to respond to this shocks?
Hello, everybody. And thank you, Winnie, for that question. Maristops International has warned that up to 9.5 million women and girls risk losing access to contraceptive services in 2020 due to the COVID pandemic. And we know this is a huge problem and huge number, because right now in Uganda, we have 52% of unintended pregnancies, even without any restrictions on the ability to move to access services. That has been our number. And also, furthermore, we have looked at data from countries like Sierra Leone that went through the Ebola crisis, and it shows us that lack of access resulted into as many deaths from maternal and child health, similar to those that were caused by the Ebola epidemic itself. So we're seeing that if we continue at this trend, we are going to have a lot of negative implications, and we're going to see a lot of unintended pregnancies as well as teenage pregnancies. So in terms of Maristops Uganda, we have noticed that we have had a reduced number of adolescents coming in for service delivery for services. And this has been across all channels that we operate. We first had a 2-week suspension of services, and that was mainly our outreach services, and we only resumed last week, and we're only operating in 40 districts instead of the nationwide coverage that we usually do for outreach, which provides free family planning services, and hence adolescents are more likely to come for those services there. So after the suspension of services, after suspension, we were able to resume our services. However, it's not business as usual. Because of the restrictions on mobilization of clients, we can't have lots of clients gathered in huge numbers. Therefore, our mobilization is very limited. We're not putting out a lot of messages on radio and also through the community megaphones that we usually use. So that through the peer educators and VHTs that we work with usually to mobilize adolescents, we've gotten feedback from them that transport, the lockdown is a major limitation to movement and hence limiting adolescents from accessing SRH services. The other challenge that we have right now is that there's stock out of the emergency contraceptive, the morning after pill. Our own brand of the emergency contraceptive, the backup, is not yet available in the market at the moment because of different delays with the manufacturers from India. So because they were also affected by COVID, we are unable to bring it into the country at the moment. So Dr. Olive talked about the higher risk of sexual violence, rape and defilement, which we see will lead to definitely an increase in demand for PAC and FP services. As well as we also anticipate that the number of school dropouts will also be increasing because of the fact that, of course, the sexual violence that we about sexual activity, therefore higher levels of teenage pregnancy. So in terms of what we are doing, we have started providing services through our outreach. Outreach remains largely at the health center because of the guidelines we received from MOH. We're unable to do community outreaches, but at least we have resumed operation at the health centers and we're engaging our peers and CBDs and PHTs to remain active in reaching out adolescents. To support them, we are working on IC materials that integrate both COVID and FP messages for young people. So that as the VHT goes out to mobilize, because these are already integrated within the government structures, so they are helping government to raise awareness on COVID in the rural areas. So we are using that opportunity to give them messages that talk about both family planning and making a case for FP during this pandemic. Our contact center is also open. It's a toll-free line and it's available for young people to call during this period because we believe this is the way in which we can provide the remote support. It also offers the real-time information and counseling that young people need and also refer them to different service delivery channels so that they can be able to get access to family planning services. So in brief, we remain committed. We have remained committed to Maristops to provide services through our different channels. Amidst the challenges that we're having, we're seeing that the community and our VHTs are increasingly opening up. We're seeing more districts are resuming family planning provision. We're also trying to go into the family planning, into the COVID task forces at district level and making a case on how we can, one, help the district raise awareness on COVID using our megaphones and our mobilization structures that we have established at the district level, but also ensuring the districts take buy-in and continue supporting us on provision of FP. So thank you.
Thank you, Faith, for that. I think just as a follow-up of sorts, what you're doing, what Maristops is doing is great. And the fact that in spite of the obvious challenges as regards having actual contact with young people amidst COVID, you're still working. Is there like a key lesson that other service provision organizations can pick from in how we can ensure that our service provision is not faulted by the unique challenges that COVID provides.
Okay.
Are there some, yeah.
Yes, so the biggest lesson has been the fact that we need to support the district and the government efforts that have been put into place during this pandemic. Our first approach when we resumed service provision was not to directly mobilize and for family planning, but to raise awareness on COVID while integrating family planning messages. So in that way, we were able to bring on board most of the district task forces, the VHTs, and the district leadership. They appreciated the fact that we are working with them to prevent the spread of COVID, but also they bought into the idea that we can put in place measures like hand washing at our service delivery points. We can ensure that our service providers have the necessary PPEs. And therefore, when they see that we have integrated all these measures, they willingly buy in and even support us with mobilization.
Okay, thank you so much, Faith. And I hope that different organizations represented on this call can pick key lessons from Marriage Stops, or even better still, work in partnership with Marriage Stops to ensure that young people everywhere are able to access family planning and sexual reproductive health services as a whole. So I see that Dr. Betty has joined us. She was speaking to how it is that we can engage other stakeholders, including the ministry, the members of parliament.
Yes, Winnie, sorry, I got disconnected.
It's perfectly fine.
I was speaking to myself.
Oh, no, sorry about that.
Yeah, so what I was bringing out is the fact that we have always been engaging the members of parliament. And I think if we could just draft a letter to the speaker, but also try as much as possible to engage the health committee of parliament, because the chairperson of the health committee of parliament is a very good advocate for some of these issues. He's an obstetrician gynecologist and has always been supportive. So those are the two things that I would want to bring out in terms of what we need to do with parliament. But also a point that has been highlighted is on the communication, and I just wanted to just re-emphasize that the communication campaign of COVID-19 should try as much as possible to incorporate the messages on SRHR, because we really need it, and family planning specifically. Then also the ministry should ensure, because many times we have realized however much we try to support the women to access services, at times they get to the facilities and whatever they need is out of stock. I don't know to what extent the ministry is supporting the supply chain, because we may advocate for women to try as much as possible to access the services, but what happens if they get there and the commodities are missing, or the service provider available cannot probably provide an IUD or any other long-acting and reversible contraceptive? So these are some of the things that I needed to share. Thank you.
Thank you for that, Dr. Betty, and also for the recommendations that you've made to that regard. Just to the greater audience, please take your microphones off. The calls start muted, so it takes your own effort to unmute. So I'd really like to request that we keep our microphones on mute until we are speaking. I would like to just picking from what Dr. Betty has pointed out. She threw out a question, almost preempted my question to Dr. Dina, and her question was on what is the ministry doing to ensure that the demand that young people might have is actually met with supply? And I guess to broaden that question even more, I would just like to ask Dr. Dina to speak on some of the great work that we've seen the ministry doing.
Thank you very much.
Overall, yes, Dr. Dina.
Thank you very much, Yua, for organizing this webinar. And the role of Ministry of Health is largely to ensure that there is governance and coordination in this whole response to the COVID epidemic and pandemic generally. And I want to say that maternal, child health, reproductive, adolescent health is one of the key priority service delivery areas that the ministry has taken on. And there is also an arm under the continuity of care where adolescent, reproductive, and child health is placed under. The role of this whole arm is to ensure that there is continuity of essential services in all these areas that I have mentioned. You may realize that that is at the district level, but there are also such committees at the national level, but you may also realize that there are such committees at the district levels and also at the regional levels. And at the district level specifically, there comes the community and all these other social networks and CBOs that we could be working with. So back to the pandemic, we've realized that the pandemic has hit mainly the mothers and children, especially because of the lockdown that clearly brought about inaccessibility to services for most of the mothers, pregnant and non-pregnant, the young children, and the adolescents at large. And this was not only for the young mothers and children, but it also affected health worker mobility, and it also affected other areas like logistics management, as you may realize, because logistics also has a component of HRM in it. So what has the government done? Government has done various things in regard to those coordination and governance structures, but mainly there's been lots of partnerships that have been created. Of course, these have been existing before COVID, but realize that these have been strengthened because, as we can see, it's a whole breakdown of the whole system, I could say. So we've partnered with Ministry of Education, and you know that most of the adolescents now and young people are at home. And I saw one of the questions coming in, what are we doing to ensure that they are getting the information and services that they could have gotten in school? So the partnership with the Ministry of Health and Ministry of Education exists to ensure that for schools, for example, that have had the sexuality education framework in their curriculum already, children will continuously get such information in their courseworks and their online classes as they get them. So there's that continuity even for children in school. But then for children out of school, I'll come to that when I come to the community perspectives of the pandemic response. So other than partnering with education, because of the key factor of the children that are in school, we've also partnered with Ministry of Gender. I've realized that the earlier speakers spoke about gender-based violence and its increase as a result of the pandemic. And we are working with gender to ensure that their call lines and toll-free centers are all open, and young people and everyone can get access to information on where to get services. This is at national, but also at the district levels. We are working with OPM to ensure that children are not malnourished. You've seen various people getting food, but people with children getting extras on milk and I think sugar. So this is also a response to ensure that children and young people are not malnourished wherever they are. But the biggest stakeholder now that we are looking to partner with is the private sector. Because as we have heard previously, and we know as young people, that most of us get our healthcare facilities, especially the SRHR services, from the private sector. A study was done and we know this very well. And just a few of our health facilities are really providing adolescent-friendly services. So key here is the private sector inclusion in this whole response, because we know that many young people would prefer to run to the drug shop at any one time, and they would quickly get their access to a contraceptive. So we are calling upon private sector to ensure that they are working closely with the young people organizations on the ground to have commodities, but also to get the information that they are required to have. Key to the Ministry of Health response is the guideline. And for those of you who have been on the National Task Force, there is a guideline, an interim guidance on how services will continue through the COVID response. I want to mention that this is a living document and we're still inputting in it. And we have put a section for adolescents and young people. So you could still contact us on what we have put for the adolescent health piece, but also other guidance on pregnancy and family planning is there. So we can continuously read to this and see how the whole framework works. So further to the lockdown, we realized that transport has been an issue. But the latest presidential national speech, was clear about the relaxed measures they have put. But we realize that it's not only pregnant mothers that need transport. Some young people will not be pregnant, but they are getting an unsafe abortion or something like this. So at the district level, we know that we are also working with various young people organizations. We have to come up and work with the district task forces to show our interest in all the work that is going around. Because as young people organizations, we know our peer-to-peer people that we are using, and they know how to contact the different adolescents and young people in the various areas. So the call is for us to actively work together at the national and also at the district task forces actively. We may have to ask, you may probably ask, how do we get to the national task force? But I think you all have different directorates, how you link to the national task force. So please come and engage, because this is the only way we can know what's happening and how we can work with the various stakeholders at the different levels. Another partnership is around communication, because we know for young people, it's mainly messaging and continuous messaging on keeping safe, preventing pregnancies. And I know, for example, Mary Stopes has given us a toll-free line. We know that we've worked with Ministry of Gender for various toll-free lines, or to avail information and service, to avail information on where to get the various services, but also to notify the districts and the Ministry of Health of any upcoming issues such as gender-based violence, if there is, or any issues around maternal death. So communication is one of the things that Ministry of Health is trying to ensure that continues to be strengthened and that there is timely response. This morning I was reading a chat on one of the social media groups, and one person wrote and said that the toll-free line that was provided, she called and they quickly responded to her call, and she was picked to go to the health facility. And once her health facility appointment had been done, she called again, and the driver came and picked her up. So such networks have been very important for Ministry of Health to ensure that it goes on. Most importantly also is the community surveillance systems that we need to ensure that they report quickly on what's happening to mothers and children in areas of abortions, for example, GBV. New reports, Family Connect have been one of those measures that we have really worked with to ensure that surveillance at the community level is happening, but also not leaving behind the peer-to-peer networks that we have as Ministry of Health. Some of your organizations have peer-to-peer networks at the communities, so please link up again with your village and community and district services to ensure that your organization as a young person or as a young person's organization is really realized at the district level. Faith gave a very good example of how it was easy for them to work with the districts. I think this is call to every one of us to ensure that you align yourself to the existing structure and seek to know how you can really come up and operate in this whole pandemic. I want to talk about the community delivery mechanisms, especially during the lockdown. I saw someone asking, how do adolescents get services? We know that the call now is they are prioritizing key services and very high-risk people. For example, high-risk pregnancies have been mapped in a way, but also adolescents are high-risk kind of category. So there are also other avenues for reaching all these high-risk priority people. For example, there are community delivery mechanisms. We've spoken about the VHTs and their guidelines on how VHTs are going to reach commodities to the various people that need them. And this is an avenue for us also as young people, because most of the VHTs may not be young and may not be in our category of people that are serving us. But we know that we also have our networks for young people, mechanisms of delivery peer-to-peer. So let's also ensure that we get into this avenue to deliver family planning services, for example, and IPC materials for everyone that needs them. Someone talked about, was wondering about how the logistics is being managed. And I want to say that up to date, the National Medical Stores and GMS are working to ensure that commodities are timely and delivered at the facilities. So like we have realized, maybe the people coming to the facilities are much lower than before, but just to reassure the public that services are available because the health workers are all present at the health facilities and the commodities too are available. So don't be left behind and say there is no one to give you a service at your facility or the commodities are not available. I want to lastly say that in attention to young people, one of the key service delivery points is now radio and TV. Because we know most of our issues are around information, we have to work again with UAF, RAPO to ensure that we have programs running on TVs and radios for young people to continuously get information on sexual reproductive health. So that is one of the key things that we have to work together on to ensure radio and TV programs for young people. If we have to have a special program for them every other day, then we have to know who has available airtime and we continuously air such important information. But then also we need to work with our local governments, our REECO and governments to ensure that we are in linkage with what the local governments are doing. Last but not least, we have already existing IPC materials, and our role now as young organizations is to request for these IPC materials when we need them, if we need to reprint them, and if you're working on ground as your organization so that the young people are not left out. On these IPC materials, I'm sure there are free lines that can be called and young people can get access to information and services. I want to beg to stop at this and I welcome any questions. Thank you very much.
Yes. Thank you so much, Dr. Dina, for that. And I would just like to re-echo a communication I made earlier on the questions. We'll be having just one last panelist give an address and then we'll get into the questions. If you have questions, please utilize the chat. One of UAF members is curating the chat, so we'll be able to read through the questions and have the panelists answer them. So thank you all so much so far for the discussion that has been going on how it is that we can put young people at the center, especially in COVID response as regards their sexual reproductive health and rights. I would like to now pose my last panel question to Anne, and just giving an overview and speaking to the advocacy. What is it how can the Ministry of Health be able to be well guided to be able to deliver essential SRHR services and information to young people and key population groups, taking note of everything that has already been pointed out?
Thank you so much, Winnie, and thank you so much to other panelists and for everyone who has managed to join in. Really, in terms of the contribution, there's a lot that has been done, but there are a lot of gaps, especially looking at young people who are assumed to be very, very healthy. And in the mix of all that is that they're sometimes forgotten. And even the young people, we need to look at young people, even when we're doing advocacy, from the point of view of it's not an homogeneous sort of population. The young people in slum areas where we're saying, okay, let's maintain social distance, but this teenager is staying in a place where, 1 foot away, you are in someone else's, room. We're looking at young people in this era of COVID who are actually are facing violence and they have nowhere, to go. You look at some of these young people who are actually in homes where violence is happening. And then in the case for Uganda, we're still struggling to find where do we connect the survivors of violence with centers. The other day I was talking to someone managing one of the centers, say because of COVID and because of the demand, they're not actually allowing in at the moment new survivors joining into the center. So you find that that bit is something that is really forgotten, and I think there's more, we need to talk about it more, so that it's not just about the medical services and all that, but also to ensure that we can do more in terms of ensuring that young people, wherever they are, they're actually safe. But at the same time, to provide, we need to have more lines that are opening up in terms of providing psychosocial support, to young people, because there's a general support that is available. But some of the support is that a line is opening for not 24 hours. So in case of emergency within, you find that where is this person going actually to go somewhere and say, call the police, but it doesn't work out sometimes that way. So I think there's need to have maybe a 24-hour sort of, line, and we can borrow from also some of the countries. And I know this is possible with partners, because it's possible to connect, the hotlines and have people maybe supporting in terms of either 4-hour shift, that sort of thing. That would be more appreciated from the point of view of young people in terms of seeking also services and guidance, rather than a certain period that maybe the phone lines are more stationary. So some are ending at 4 or 5. It's like nothing happens after 5. So I think with technology, it is possible to actually stress. I'll give an example. Through advocacy and pushing, for example, like now the Ministry of Gender, like in Kenya, has actually moved the lines from being stationary because of the also ongoing curfew to something where like the counselors or the support are able to utilize the lines outside, so that they make them more mobile. So it means we can have more volunteers who are qualified to actually offer this support without necessarily endangering anyone. So that could be in terms of also a lot of collaboration. I think Faith has also spoken about use of the VHTs, and then also let's look at the community health workers where they exist. I think we need to really push more, especially more than ever, the utilization of also the community structure to also serve adolescents or young people in this case. And let's also remember, young people are a resource for themselves. Young people would want to volunteer. They would want to come out, but because in their communities, but because they overlooked in terms of it may be an issue of experience, it may be an issue that what can they, but we have peer educators in the communities. And this would be much needed in terms of offering support within the confines of the guidelines, or linking young people also to services. So I think utilizing such a structure and having young people doing more in terms of also coming out and volunteering would be much appreciated. So in the other thing which I also would want to say is that the young people, let's even know the issue of then pushing for young people to be involved even in terms of decision making, because right now we know that the young people are really very an active age group, and they are also they have the characteristic of pushing really boundaries. But now in terms of then the lockdown, what packages do we have outside a lot of push, a lot of pressure in terms of studying. Maybe we need to actually think of partners collaborating, where part of this education, either maybe during the day there's a break that the TVs are giving for 1 hour, where we are talking about sexuality education, we pick a topic. that we can discuss, or young people call in and then ask. That way, it's more interactive in terms of also opening up that space. But I see that there are challenges that are ahead, especially both in terms of mental, in terms of drug abuse, because the young people who have been users of drugs are now in this, in this scenario. We find ourselves that in such communities, like if now we're talking about transit communities, most of the people who are involved really in sex work are actually young people who are vulnerable, who truck drivers can easily take advantage of in this situation where even livelihood or survival is a challenge. So I think there's more that needs to be done in trying to unpack the needs of young people amidst the lockdown and COVID. And together with the ministry or government departments, we then work together in terms of the partners with young people involved and on the table to really push for responses that are actually serving young people themselves, and not necessarily the general responses that may be working but not necessarily working for young people.
Thank you, Anne. Thank you so much for that. And thank you to every one of our panelists for the great insights that you've given us. I think underlining all your presentations has been the value of collaboration, the need for us to utilize the media to ensure that just as other COVID messages are at the forefront, family planning messages are also at the forefront, to expand our advocacy and to be able to utilize community existing structures, as well as work with the Ministry of Health to utilize the existing guidelines, especially in service provision. So with all of that, thank you once more to our panelists. I will just share some of the questions that have been posed. Some of them have been directed to particular speakers. Again, I would like to reiterate that if you have any questions, please utilize the chat and we'll try to address them. So someone is asking if there will be a report. Yes, after we will share a report with all the participants tomorrow. So we hope that we'll also be able to share the video, at least the video recording of this webinar on our Facebook page, which is Uganda Youth and Adolescents Health Forum, and also a link on our Twitter page. So please keep your ears to the ground for that. I see that Raymond Ryoka to Dr. Olive, he poses two questions, and it's in regard to involvement of religious and cultural leaders as key players in increasing access to services. For example, Bishop Kazimba. And then he also brought a point on government giving stickers to cars of NGOs to help transportation of family planning commodities for young people. And he gave the example of Reproductive Health Uganda and says that not having stickers is actually affecting the organization. So Dr. Olive, she's still on the call. Okay, doctor is not on the call. Could I post that to Dr. Dina?
Thank you very much. I think the question was mainly around engaging religious leaders and cultural leaders, if I got it right. And I seem to understand that I seem to hear that he's encouraging us to do that. Is that the case?
Yes, and then there's also a question on government giving stickers to NGOs to provide family planning commodities. for young people.
Okay, thank you. I want to also say that the issue around stickers has been a bit, the pressure has been lessened, and the issue is to come through to the Ministry of Health, to the Undersecretary, because he's dealing with that kind of provision. And then you request, and there's a form that is given for your organization and all these details about the cars and the drivers, and the stickers will be able to be processed. So Raymond, I think this is something that can quickly be fixed if you came straight to the Ministry of Health and you went to the Undersecretary's office.
Okay, thank you for that, Dr. Dina. I see another question. So before we lose you, do you think food distribution has been effectively executed? I am not sure if it's something we can address in this platform, but yeah, sure. Do you?
Thank you very much. Again, the moderator, and thankful that you know that I'm not the best person to answer this because I don't directly work with the OPM's office. But I think, largely speaking, this is something we cannot say has been part of our primary mandate as Ministry of Health, like I've said earlier. All that we are also benefiting from is what we are seeing on the social medias and the TVs and all these things. And in my opinion, well, I think for starters, they are doing well, but also to ensure that they process, fasten the processes so that everyone gets to get the packages that they should be getting. But honestly speaking, I can't speak so much to the food distributions.
Okay, thank you. Thank you, Dr. Dina. Faith, I know you spoke about utilizing VHTs and local community structures in service provision. There's a question here on how is it that you're ensuring that VHT members give attention to, you know, FP messaging while we know we are dealing with demand for food? Faith?
Oh, thank you, Winnie. So our approach to working with VHTs has been ensuring that to work with VHTs that are already supporting government on COVID awareness. So by the nature of the fact that these VHTs are still moving door to door with posters, with megaphones, sensitizing people about hand washing and washing with soap, it has been easy for us to give them messages on family planning and tell them to integrate them into their messages as they move from from sub-county to sub-county. In doing so, I think VHTs themselves have appreciated the fact that people are idle at home and therefore increased sexual activity, and therefore they have also understood the fact that same constituency that they are giving messages on COVID also needs to be sensitized on family planning. We have also intensified our Maritext messages. It's a platform we use to blast thousands of messages. And these now go out to VHTs on a regular basis, reminding them of where outreach services are going to be in terms of which health facility will be providing family planning services closest to them, but also just reiterating to them the fact that they should talk about the Ministry of Health recommended guidelines on COVID prevention, and also the fact that we should also consider the fact that we're trying to reduce unintended pregnancies during this period.
Thank you, Faith. And just so you stay in line, on SR, someone is asking how we can reach boys and men during this period with SRHR information. And
okay, so for the urban-based young people, we are collaborating with organizations like Reach a Hand Uganda that has a huge online presence, and they're conducting actually live concerts on different social media platforms with very popular artists. So in the middle of these concerts, they are advertising the toll-free number as well as integrating messages on sexual reproductive health, as they also talk about COVID. So we have found that this has been very effective in reaching even over 50,000 youth in just one session and 1 hour. For the rural youth, we're still working through peer educators. These are usually school youth and they are young people themselves, so they know where to get their fellow young people. So we are working, giving them calls on a regular basis, reminding them that they need to mobilize.
Let me first finish a meeting and do it, then I'll call you back.
But largely young people at their homes, so that's where the peer educators are going to find them.
Okay, thank you so much for that, Faith. Noor, if I could pose the next question to you, and it's, are adolescents the only subpopulation at the risk of unintended pregnancies during COVID-19 crisis? And Diana is just asking if maybe we should expand our focus to other groups like postpartum women.
Thank you so much. The organizer of the webinar is Uganda Youth and Adolescents Health Forum. And,
yeah.
Anyway, to be realistic, that almost all women that have access to partners and husbands are with them. The young people, I said partners and husbands, are with them. So young people could be husbands or partners. Obviously, they are vulnerable as well as other women, including those that have just delivered, because access to some of these services is not very easy. So, like I earlier noted, the health sector is going to be burdened by unintended pregnancies, and we really need to act both on the young people, but also women, as well as the men, because to some families, I know that it's the men that actually use family planning instead of the women for them. So access at this time becomes very, very critical. Thank you.
Thank you so much for that, Noor. So I see that most other things are comments and not questions. And since we have 3 minutes before we end this, perhaps I will give our panelists. Yes, Noor, I see that you raised your hand.
Raise the hand because there's a person asking, how do we as young people organizations reach the speaker with the requests, a letter to the speaker? And I think what has worked for us has been email. If you have contacts in Parliament, you can actually write the letter to the speaker and send it to the email of the speaker, as well as the contact person to push it forward. Reason being that you don't want to go through the hassle of asking for permission to move to Parliament, yet it's just a button away. So kindly send the email. Let me send the email of the speaker in the chat. Thank you.
Okay. I thank you for that, Noor, and for pointing out that question. I see that we have other raised hands. I can't see them.
Hello.
Sorry. Jonathan, you raised your hand?
Yes, in fact, thank you so much for this wonderful conference. My question, I don't know whether
I'm so sorry, your sound.
Hello.
Yes, your sound seems to have an issue. If it's possible for you to type out your question, that might help us even more. Yes, please.
Okay, let's see if I can repeat.
Thank you so much.
Okay.
Okay, so we are at the point where we'll just get closing remarks from all of our panelists. Just a minute. I would like to thank you all once again for being a part of this webinar. Great discussions and even greater opportunity for follow through, and hopefully as different organizations that focus on young people, we can be able to take some of the the suggestions that have been made during this webinar and put them into action. Just so we can have some closing remarks. I would like to invite Noor. It's okay, since you are the last person to speak. And then we'll have Faith after her and go in that order.
Thank you so much. I'm truly humbled to be part of the webinar. I should say that as Ugandans, we have been so good to ensuring that COVID-19 does not affect us all. And I request that we actually proceed as the president in the various task force members of COVID actually advise us. But most importantly, as civil society organizations, we are privileged to actually have Ministry of Health officials here and development partners. So our voice is more heard when we actually have these people. I would inquire or request most of you to actually utilize all the contacts we have to make sure that people are not affected, and to make sure that we actually access the services, because access to services is one of the reasons why we actually have these governments into power. So we still have the social contract with the government, and we should not at any one moment allow any rights to be violated. Health is a very important right, and it's only the one who is alive that can actually vote. So I want to thank you, and again remind you to move with the directives as provided. Thank you so much.
Thank you so much, Noor, for that, and thank you for the great work that SEHAD is doing, especially in ensuring that the right to health is upheld and that advocacy continues in spite of COVID-19. Faith?
Thank you, Winnie and Yura, for organizing this webinar. I want to first start by repeating the toll-free number, which is 0800 220 333. It's available Monday to Friday, 8 to 5 p.m. So in conclusion, I want to urge all of us to remember to prioritize SRHR, because despite the competing priorities that are posed by this crisis that we are in right now, it's vital that we maintain the momentum and we maintain the investment that we have already made in ensuring that family planning is available, and in particular, ensure that it's available to the vulnerable and rural communities. Thank you.
Thank you so much for that, Faith. I would like to, and I hope, I see so many questions on the toll-free number, so I hope that we've all taken note of that. Could I invite Dr. Dina? And perhaps Dr. Dina, if you could also point out, someone was asking how we can access the guidelines.
Thank you very much, our moderator, for moderating us very well in this discussion. And I just want to say that SRHR, as I spoke earlier, SRHR in general, and also SRHR for young people, is a key priority for the government in this whole response to COVID. So as CSOs, as partners, it's our role to place ourselves in this whole response to ensure that we work closely with government in ensuring that everyone is reached. All the young people are reached, and everyone in their different cohorts. And we've made a special mention of young people's mental health status, and especially drug abuse and getting involved in transactional sex. But it's only those of us who are working with these people already who can actually identify to this problem very clearly and make a statement on this. So as we work around the COVID response, SRHR is a priority for the government, which is a good thing for us, and that means we have space to act. Secondly, young people have a role to play in this whole response, and it's two-way. We as young people can actually help in the service provision of IPC. I've seen FOU doing various innovations to reach the communities, but also the other role as young people that we have is to actually use and utilize the information and services that they are. So in whatever we are doing, even as programmers, don't just program, you also ensure that you use these services that are available and then you make sure that these services get out to all the other young people that you're really working out. Lastly, you asked a bit about the guidelines. I sent my email to one of the people. Please, you can write to me, and then we go through the right channels to get the approved guideline to everyone. Thank you very much.
Thank you, Dr. Dina, and also thank the Ministry of Health, because like all the panelists have pointed out, we believe that great work has been done, and we know that as long as young people are still at the center, we hope for great strides to be made. Thank you, Dr. Dina. Dr. Betty, do we still have you? Yes.
Really, I'm still here. Would like to appreciate. Oh.
You're
I would like to appreciate all the efforts that UAF has put into this webinar. Thank you for organizing it, and on behalf of the National Population Council, I just want to remind everyone that mitigating the COVID-19 impacts on SRH and rights for all women and adolescents is very critical, because one of the things that we have to make sure that we don't ignore are the neglected gender and social inequalities and what they finally impact on. We make so much reference on the health and well-being of women and adolescents, but we should also look at the ultimate, which is development. So for us at the National Population Council, family planning is not only for the health of women and their children, but for the well-being and overall national development. And that should be factored in all the messages that are being communicated during this COVID-19 pandemic. Thank you very much, and thank you once again for inviting the NPC to this panel.
Thank you so much, Dr. Betty. It's always an honor to have you with us, adding your voice to young people's voice as we continue to advocate for sexual reproductive health and rights. Dr. Olive is no longer with us because she had to attend a COVID-19 coordinating meeting. So I would like to pull in
Anne?
Anne, yes, I'm pulling in Anne now. To last but not least. Yes, Anne.
Thank you so much, Winnie, and to everyone who has made it and the panelists. My key message is that we need to collaborate more in terms of sharing the information, as well as sharing innovations around what we are doing as partners. There's a lot that is going on, but the collaboration is scattered. Some people have an added advantage that they can have stickers. They can then, be able to, to deliver certain commodities, maybe to young people. Others may not have that that privilege, but at the same time, there's something that can be done in terms of linking with those who can. And I think this is the time not to look at competing with each other or trying to outshine. Rather, the focus should be on how do we deliver as one really for young people, because then it can't be civil society against government, young people against adults, or CSOs against, CSO. I think this is the time also as civil society to rethink how work is actually being done. And then this is the time to also rethink within what we are doing, talking to also donors about what is the reality on ground, so that if it means asking for change in terms of the budget to contribute to what is happening within the adolescent health, then be it. It's time to really do more and focus around the adolescent health if we are to mitigate to some extent, some things that are going to really happen in a few months after COVID, or when we no longer, lock down. So it's very important that we prepare now during COVID, and we need also to prepare with the same energy post-COVID, because what may hit us if we don't do much during this period will be overwhelmed, the youth centers, the, you know, the pregnancies, all these other things. So it means that we need to prepare now, for now, and also prepare for the after lockdown. And it means we need to be more innovative, and then be able to listen to the urgent needs of the adolescents or young people, but at the same time be able to really see which channels and what more can different stakeholders do in terms of ensuring that still the young people's SRH remains a top priority and we are answering to their needs.
Thank you so much. And we can't close in any better way than all the great recommendations that have been made by our wonderful panelists. Once again, I would like to thank you all for being a part of this great discussion. I will share again that we will share a report, both hopefully in video and written form, just for those who are not able to maybe stay on the call the whole time. I'd also like to thank very much the UAF team who have been in the background, ensuring that we are up and running on social media, but then also curating the chats and trying to respond to some of the questions that come up there. In case you might have specific questions for the panelists, we will try and see how to ensure we get those questions to them. So in closing, making a case for sexual reproductive health and rights come to life amidst the COVID-19 pandemic requires that we approach this very unique challenge with unique means. So it should not stall our efforts towards creating a world where every girl and every boy is able to enjoy their sexual reproductive health rights, but should rather push us to become innovative, just as the panelists have pointed out. As UAF, we truly look forward to working together with various of you organizations and the Ministry of Health in the different strategies that we have come up with to reach more young people. And we look forward to your engagement. We will be having more webinars. So please, I hope that you'll be able to join us on our next webinar. The topic and the date will be shared with you as well as the participants. So we hope that you can be a part of that. But even post-webinar, we hope that you will be a part of some of the engagements that we hope to have as we continue to advocate for young people's sexual and reproductive health and rights. On social media, just to share the hashtag for this webinar, in case you'd like to follow or to add your thoughts to it, is making a case for SRHR, which is hashtag making a case for SRHR. And once again, more conversation will take place on our Facebook and Twitter pages. So with that being said, thank you all again, and I hope to have you again during our next webinar. Have a good evening. Bye, everyone.
Bye, Winnie, and thanks.